We've all had the fortunate capability to witness a revolution. You've probably all seen this image, but in 2005, Vatican City looked like this, and 5 short years later, like this. We are in the selfie generation. But what all of those teenagers don't have are the regulations of medicine. So for every time a doctor loses his phone with patient data on it, he or she are required to let the patients know and has the opportunity to pay a fine for $50,000 per photo. CaptureProof is changing this. Medical images start like this as a data set, but very quickly turn into this. CaptureProof is putting the doctor's eye in the palm of the patient's hand. It is HIPAA compliant and allows doctors to see A versus B, so you truly know whether a patient is getting better or not. That's my niece. She's not sick. So as I said, it's telemedicine for doctors who don't run on time. Because even when you have to show up for a video chat, someone is on the other end, and the synchronization requires there to be a meeting. CaptureProof allows you to do what you learned as a 5-year-old is very powerful. Use show and tell versus just telling alone. So what do we do? CaptureProof is essentially the prescription pad for photos. You have the ability as a physician to request a very specific set of information from the patient. The one on the right is actually text that the doctor has written, and in a video, the text always shows up in the active camera. Once you've taken a photo, however, that initial photo is overlaid in the active screen so that as you take a photo, your angle is the same and your information is continuously consistent. Very shortly, CaptureProof will be CaptureProof will be active and the patient will be passively capturing this information. Now, what does it look like in Compare? I'm glad no one's eating. So this is a second-degree hand burn healing over time. This allows patients to show their doctor whether they're getting better or not without having to go into the doctor's office to show. CaptureProof takes it a step further with video as well. We worked with Kaiser Permanente in order to help them with their total knee replacement patients. The use of CaptureProof in order for incision site management and range of motion recovery reduced in-person visits by 80%. Thank you. $7,500 per patient. This is Cornell right here up in the Upper East Side. And Dr. Clara Henschkoff is using CaptureProof to automate the Parkinson scale from home. So patients, as their disease progresses, will not have to come in for medication modification. These patients are elderly, generally, and have to come in at least once a month. Oh, I feel like I missed a slide. There you go. So our beta results have been very astounding. CaptureProof is reducing in-person visits at Kaiser, as I said, 80%, but even more interesting, saving clinicians 66% of their time per patient. People are asking, well, don't doctors want to see the patient? Most surgeries now are called bundle paid. So you get one payment and it covers the next 90 days of care. So keeping a patient out of the doctor's office is of benefit to everyone and not a financial reduction to the doctor. For neurology and seizures, we had the ability to reduce urgent patients by 78% and cutting emergency room visits in half. I'll just go right past that. We worked really hard to be the entire hospital solution. So CaptureProof is being used in 32 subspecialties across the hospital, saving time and money, and a lot of doctor's visits. These are the hospitals, if you're lucky enough to be going to, that have the opportunity to use CaptureProof. Right now, 80% of doctors across the world have smartphones in their pocket, and 40% of them actually believe that mobile technologies can reduce the number of office visits. I believe as time goes on, it will get closer to 100. But the most interesting statistic up there is actually 88% of doctors want to monitor their patients at home. The time is definitely now, and CaptureProof is definitely the product that's allowing doctors to have a virtual visit at any moment from anywhere. Thank you.